Miss K is a female in her 90s. She has a history of heart failure, AFib, and hypertension. She presented to the ED with the complaint of shortness of breath on exertion. It had worsened over 3 days, and she was admitted with an acute exacerbation of chronic heart failure with a reduced ejection fraction. What that diagnosis means is that her heart can't contract with enough force to perfuse her body. It happens when the heart muscles weaken, often as a result of hypertension. We saw effects of this left-sided heart failure because we saw fluid being built up around her lungs, causing that shortness of breath, increased work of breathing. And then we also did see some peripheral edema, which is evidence of right-sided heart failure. At home, she takes apixaban, which is an anticoagulant for AFib. She takes bisoprolol, which treats dysrhythmias, hypertension, and heart failure, Jardiance, which reduces cardiovascular death, Lasix, which treats edema. At the hospital, she was started on heparin in place of the apixaban, potassium chloride to treat and prevent hypokalemia, and then she also has spironolactone added to treat edema. The anticoagulants work by interfering with clotting factors, so they slow down the amount of time it takes for blood to coagulate and clot. Diuretics work in the nephrons of the kidneys to excrete water, treatment of that fluid overload. And then that potassium chloride gets added in as a supplement because furosemide is potassium wasting. So we want to make sure that electrolyte stays in balance. Bisoprolol is a beta blocker, works on those receptors in the heart, causing the heart rate to decrease as well as the contractility of the heart to decrease. Jardiance is an SGLT inhibitor. It's been shown to reduce cardiovascular death and the number of hospitalizations for patients with heart failure. Important considerations for older adults. Diuretics are the most common cause of adverse medication reactions and interactions in those older adults. So watching very closely for dehydration and for cardiac dysrhythmias is important. Also monitoring hepatic and renal functions, as we know these are, there is an increased risk of these being impaired in older adults, and monitoring these to ensure that medications are being metabolized properly and maintaining therapeutic levels. Cultural considerations. When thinking about medications, heparin is a big one, to ask patients whether or not they are able to consume pork. This patient was, so it wasn't of a concern. But if this would have been, we would have switched it for a different anticoagulant. Also asking about the patient's diet and if there are any cultural foods that they consume. For this patient, she needed to be on a low sodium diet. So that's just making sure that we're adhering to that. Other cultural considerations include asking about the patient's view on family involvement, end-of-life care, and if there are any spiritual practices she observes in hospital. Socioeconomic considerations for this patient. She did not report to have a problem affording her medications, though she was on a fixed income. She did, however, have a problem obtaining her medications because she lived in a rural area 2 hours away from the hospital. So in her discharge planning, we did discuss ways to obtain medications and collaborated with family to determine how she would get to future appointments as well. When considering the nursing interventions for drug administration, I assessed swallowing. I also assessed her vital signs before and after, especially that heart rate and blood pressure because of the beta blocker. Monitoring fluid status was important because of the diuretics, both before and after giving the meds. Lab work, especially to monitor, were her kidney levels, electrolyte levels, clotting factors for the heparin, and then telemetry to just observe for any kind of dysrhythmias. Assessing the effectiveness of these medications, the anticoagulants, we were looking at that therapeutic level based on the blood work, which was maintained. For diuretics, it was watching for weight loss, ease of breathing, and for some of that fluid to be excreted. Heart medications, the beta blocker, we were watching that the heart rate decreased and the blood pressure decreased, but maintained in the appropriate levels. Other considerations for this patient, she was an older adult and was spending a lot of time in the hospital alone. She had feelings of isolation. So when thinking about how I provided education, I was really watching her mood and asking her how she would like to get education. This ended up being best done in the company of her support network, her family. I taught her about the apixaban, which is that anticoagulant, because it was being restarted, using the teach back method so that I could ensure that she understood that bleeding risk is elevated and that she needs to take each dose at the exact time it is ordered.